InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is Erica Hornthal. Welcome, Erica.
Thank you. Thanks for having me.
Well, I'll tell the audience a little bit about your background. Erica is a licensed clinical professional counselor and a board-certified dance movement therapist specializing in cognitive and movement disorders. Erica has a bachelor's degree in psychology from the University of Illinois and a graduate degree in dance movement therapy and counseling from Columbia College, Chicago. Erica is the CEO of Chicago Dance Therapy. Well, our audience may not know what dance therapy is. Why don't you explain it to them?
Sure, I would love to. So, dance movement therapy is the psychotherapeutic use of movement to basically integrate the mind, the body, and the spirit. So, although we use the word dance to represent more of our modality and the art form that we represent, it really is more about movement. It's about resourcing the body language, the gestures, the postures that sometimes we're not even aware that we embody.
Okay. Now, before the show, we were talking, I asked you if you did groups, and you really had a wonderful answer. So why don't you tell the audience, where you teach, some of the places, etc.
Sure. So right now we have a studio based out in Northfield, and we do some groups there. We do a Parkinson's movement group. We actually have some groups that are based in facilities like adult day services, nursing homes, hospitals. We do some work in the schools. But I would say...
What would the ages be for the schools?
Let's see. So right now we have, I would say mostly elementary, maybe middle school. We do some workshops from time to time in high schools. And then really our age range, just from the services that we provide, we say 0+. We've done work prenatally. We've done work with women during pregnancy. And we've had the pleasure of working with people all the way into their hundreds.
Okay. Well, so let's say you go to a school. What exactly are you going to be doing with the children in the school? So
it depends. Sometimes schools specifically want us to come in and do after-school programming. So it might be more therapeutic movement. Sometimes we've done a little bit more mindfulness or even like meditation. But more recently, we've had schools contact us about implementing some type of mindfulness into their curriculum. So we might come into their homerooms. We might come into a specific period during the day where kids are a little bit more anxious or a little bit more energetic, for lack of a better term. And so it really just depends what the teachers or what the administration is looking to make happen. Certainly we come in and we'll help kids with special needs that might just need a little bit more encouragement, a little bit more help throughout the day.
Okay. And what are some of the schools? Can you mention the names of the schools? Any local schools here?
We do local schools, so I'd say like some schools in Wilmette. We've done work with some of the high schools in Highland Park, Deerfield. Right now, mostly North Shore. We're trying to work a little bit more with schools in Chicago, but it's a little hard. It gets a little bit tricky with CPS just because the vendor process is a little bit difficult. But that doesn't mean it's not possible. So.
And how long has dance therapy, dance movement been around?
So formally, probably since about the 60s. But originally, we kind of think back to the first movement therapist, was practicing in the late 1940s, early 1950s. Marion Chase did not call herself a dance therapist. She was a dancer, choreographer, that was asked to go into a psychiatric hospital to help with chronically ill patients who I think for the most part were nonverbal, and they were looking for a way for them to help express. And so she's what we call the grandmother, the grand dame of dance movement therapy. And from there, she had students and I guess what we call disciples carry on her legacy and her work. And then in about the 1960s, the American Dance Therapy Association was formed. So that is our governing body. That's our body that regulates our guidelines, our bylaws, and our licensure. So, it's been around for a while.
And so you're licensed by the state.
I'm licensed as a counselor by the state, and then our dance therapy credentialing is either registry or board certified, depending on how long you've been practicing and if you've completed your coursework.
Now, I'm familiar with Columbia's dance therapy program because I did dance therapy for a few years myself, and so there were students from the program that I participated in a group.
Right.
How many other schools have dance therapy programs in the country?
So I'm not an expert on this, but let's say a handful. There are maybe 5 in the country. It's a very small percentage, unfortunately not on par with art or music therapy programs in the United States. So you just have to research and make sure that it's a program that you're interested in, because their focus is a little bit different depending on which program you go to, and just what area you'd like to settle in and like to get your degree in. I really wanted to stay in Chicago, and so I was very motivated to go to Columbia.
Okay. Now, before the show, you told me you have a 2.5-year-old. Did you use dance therapy when you were pregnant yourself, and do you ever use it with your child?
I wouldn't say I use dance therapy formally, just because as a practicing therapist, I never want to do it on my family.
Yeah.
I just have to practice those safe boundaries. But, I would say as a dance movement therapist, having a child, I was very aware of the movement milestones that she was meeting or not meeting. I was really aware of some of the connectivities we talk about, how the body expresses, or before we're verbal, how we're starting to express ourselves through the body. And getting to watch her move through those and acquire those was very eye-opening, because originally I had read it in a textbook, but I didn't grow up around babies. I'm an only child myself, so having her was really an amazing experience in many ways, but certainly developmentally, because I was like, wow, I learned this in a textbook, but now I'm actually seeing it take place.
Mm-hmm. And do you ever encourage her to move?
Well, she does that herself.
Okay.
She's a big mover. I don't know if she got that from me. So I myself have not pushed her into dance, so to speak, yet, but she's very expressive, so expressive with her gestures, her face, even her voice, her inflections, even just, for being 2.5, she's just very expressive. So I have a feeling dance or theater or something along those lines will be in her future.
Well, would you agree that children move before they become verbal?
They do, and I think that's why as practitioners, we tend to understand when there's maybe a delay a little bit before sometimes parents do. Sometimes we look for that verbal cue, or we want to know that language or just noise is coming into play. And if we're not hearing that, we give it a little bit more time, whereas as movement therapists, we can kind of see early on if those connections, those body connections, which correlate to psychological development, aren't quite there, and we can really start early interventions to help a child get back on track.
So if I understand you correctly, if you have a child that may have some disabilities or is not where the child should be for his or her age, a dance therapist, movement therapist would be excellent choice.
We like to think so. Again, people get caught up on the word dance, and they think, well, if my child is having trouble moving, how are they going to be coordinated enough to dance? And again, it's not really about formal choreography. It's not about putting a string of movements together. It's about validating and supporting the client, the child, the person in their current movements.
I understand it because I've done it, but life is a dance, and you don't have to be on a dance floor to dance.
Nope.
Just going from your house to your car could be a dance.
Absolutely. Yeah. I mean, I honestly say if you're If you're not moving, you're not living, literally, right? Because if we're not living, we're not blinking, we're not breathing, we don't have a heartbeat. And if you have all of those, you can participate in movement therapy. It's a wonderful alternative to talk therapy, especially for our clients or loved ones, family, friends that have difficulty expressing through verbal communication.
Now, you're the CEO of Chicago Dance Therapy. Why don't you say a few words about what you do with the Chicago Dance Therapy?
Sure. So about 5.5 years ago, I ventured just myself into private practice and kind of toyed with the idea of maybe someday it being a group, right? An actual agency or practice.
Like a group practice?
Exactly, where all we do is concentrate on dance movement therapy through all different stages of life, all different ages, all different needs. So that was kind of in the forefront, but originally when I started my company, I was only working with older adults, primarily with cognitive and movement disorders, so dementia, Parkinson's, Alzheimer's. And even though I'm running the company and I have other employees now, that's still primarily what I do. I'm going into nursing homes, day services, different programs, and into individuals' homes, working with people who are usually mid to late stage in their dementia.
And how well does the people you work with receive you and your work, and how well does the staff? What's the staff's impression of you coming in?
Well, so client-wise, I think it must be working because they tend to perk up when they know it's dance therapy time. And people, whether it's a terminal illness or it's a life issue that has then kind of morphed and they're just looking for some wellness, people really respond to that holistic approach. So I don't know if it's personally just me, but movement therapy, I think, is an eye-opener, and people really grab onto it and want to stay with it. As far as my staff, it's funny to say that because it was just me for so long, but I think that they would say I'm supportive. I know what it's like to work in an environment where you're not supported, where self-care isn't a priority, and where work is at the forefront, not the clinician and how well they're doing to then support their clients through their issues. So that's really at the forefront when I work with my staff, or if I bring someone else on, is that they're taking care of themselves and setting that model for our clients. So I like to be supportive. Not too much. They have to have their private life. But
Okay. And how long has Chicago Dance Therapy been in existence?
About 5.5 years. We incorporated, 5.5 years ago, and we're going strong. So
Now, are there other Chicago Dance Therapy groups, practices like yours, or is yours like the only one in town?
yeah, right now, yeah. So there are quite a few counseling, wellness-based, holistic-based counseling practices that are starting to hire art therapists, music therapists, even dance therapists. I can't forget my drama therapists. But no, I think that was actually why I thought, you know what, this might become a group practice someday, just because there were no other agencies specifically geared towards just movement therapy. So at this point, we service all of Chicagoland within reason, just because we can only be in so many places at one time.
Okay.
But yeah, we're kind of it for right now. Doesn't mean it won't happen in the future. But
All right. What is somatic experiencing?
So somatic experiencing it's a body-based approach to healing trauma and other stress disorders. And oftentimes people will ask me or ask our staff if we're somatic psychologists or do we work in somatic experiencing. And the fact that now they're actually two separate things is just something that we always try to explain to our clients. Somatic experiencing was introduced in 1997 by Peter Levine, who does amazing work with trauma. And I think there's a lot of overlap. I think that obviously being movement therapists, we work in the body. We do work with somatic experiences, but there are definite differences as well.
Okay. Yeah, so my question would have been, is dance movement therapy related to somatic experiences? experiencing, and I guess the answer is there is some overlap.
There is some overlap, but
there's
they're
different training.
absolutely.
Okay. Is dance movement therapy related to physical therapy?
I would say really at the heart of it, no. Physical therapy is it's a physical rehab, right? Or almost like a medicine physically. And it's more based on manipulation of muscles, activation of certain muscles. It's very different from movement therapy because all of the movement that we tend to do is coming from our clients. We're not placing movement necessarily on them or even manipulating the body in any way. And there's a psychological underlay to it versus functioning, right? Sometimes it increases functioning, but that's not our primary goal, whereas with physical therapy, it usually is.
Yeah. Now, do you ever see clients one-on-one?
I would say 50% of what we do is probably individual.
Okay. And so with the individual clients, what are they coming to you or other members of your practice?
It kind of runs the gamut. Obviously, I tend to work with, as I mentioned, Alzheimer's, dementia, Parkinson's, end-of-life issues, but we have a large side of our practice that sees autism, sensory disorders, adults.
I mean, sensory, like people going blind or losing their hearing, or something different?
Well, yes, it could be. More sensory integration, right?
Okay.
So tends to be more with children that are having problems processing all of the sensory intake around them. You know, we will see individuals that are just looking for someone to talk to, just having a hard time getting over job loss, grief, you know, death of a loved one. You know, we do, you know, mood disorders. So we'll work pretty much, you know, a lot of anxiety, a lot of depression, personality disorders. So there's a little bit of borderline, bipolar mood disorder. So it really kind of just, it's a pretty big span.
I'm interested, you know, depression, a lot of people with depression, they have trouble getting motivated. Same thing with anxiety. I would think it would be a very effective treatment if you can get patients involved.
Yes. We have actually quite a few clients that I would say their primary reason for coming or reason for needing therapy is around depression. Whatever their symptoms happen to be, obviously vary. But yeah, sometimes just committing to the therapy and showing up weekly is goal number one, right? It can be very hard, very motivating. I think what happens and what changes for them is that within usually the first one or two sessions, there is this body sensation. There is a feeling that they're tapped into that is enough of a reason, enough of a motivator for them to come back the next time. And so if they're having a hard time talking or they're not sure what to talk about and nothing's really been said in the first session, the tendency to come back the next time is a little bit harder.
Yeah, makes sense.
So it does make it hard, absolutely. But I think sometimes that motivation is enough to get them to come back the second time.
Okay. Now, do you see dance or movement therapy as a trend or a fad?
I sure hope not. I don't. You know, I think unfortunately for us right now, there is this trend in different wellness techniques, topics, which is not a bad thing. But for us, we really hope that it's here to stay. You know, we don't want people to think, well, you know, this type of movement or this type of exercise is only going to work for now until the next trend happens. You know, movement therapy has been around for a really long time, and I think that now we're at the point where people are starting to expose it and learn about it. So we're just touching the surface, and I think it's really going to be the new wave of talk therapy, another way to engage the body and
I agree,
heal.
because my experience of movement therapy, it's very creative. You know, when you choreograph a dance or, you know, a therapy or a therapeutic exercise, I mean, there's a lot of creativity and thought goes into it, and then when you actually do it, you know, and then to feel what you the feelings while you're doing it. It's incredible.
I think there's a big piece in the witnessing too, so
Right.
it's one thing
Yeah.
to perform a dance and have someone, watch and applaud, but to have someone witness your movements as an expression of who you are and your belief system, or lack thereof sometimes, is very, very powerful.
Well, in the group that I was in, other members of the group would participate, so you could be in somebody else's dance and then express what it was like, so you end up developing a lot of empathy.
Absolutely.
Yeah.
That's one of the things we're starting to work and toy a little bit. It's not new by any means, but in this area, we're trying to bring movement therapy into the schools more, because movement is a way to empathize, to decrease bullying, to work with violence prevention. So yeah, empathy is a big key.
Before we sat down to tape this interview, I overheard somebody talking about the election and how they felt bad. Can you imagine, a Trump supporter dancing as a Clinton supporter and vice versa, to be in the other person?
I'd like to imagine that. I don't know if we're there yet.
No, I think it would be quite insightful.
Yeah.
What it would feel to put yourself in the shoes of the other person.
Exactly. And I think, now is the time for something like that to happen, because there is so much animosity and just so much, people kind of going at each other. We just need to understand and
Well, we're split 50,
move
almost
together.
50-50 down the middle.
Right.
And
we're not all going to see eye to eye ever, but yes, recognizing someone's movements, postures, their attitude, just in how they carry themselves, is a way in, and just a way to empathize and just accept someone else's viewpoint, not take it on or not feel like you have to take it away.
Fully agree. So, Erica, what led you into the dance movement therapy field?
Oh gosh. I think I've always known that I wanted to help people. I was always kind of the mediator, or the go-to for problems.
Did you experience dance therapy yourself before you started to study it?
No, I had no idea. So I went into my undergraduate program kind of undecided. I wanted to be a dance major, but I knew that wasn't necessarily going to work out. And I started taking psychology classes, and I loved it. It just clicked. And so I thought, well, maybe this is how I'm supposed to help people. Maybe I can help them emotionally. And it was a professor actually that said, don't discount dance altogether. There's a way that you can marry the two. You should look into being a dance therapist. And I'm sure I looked at her like, did you make that up? What is that? And she said, just go home or go back to your dorm room, do a little Google search and research dance therapy. And sure enough, I did. I found the American Dance Therapy Association. I joined that night, became like a student member, and then just kind of refocused and decided I'm going to get my degree in psychology, and then ultimately apply.
Were you a freshman, a sophomore?
I was a freshman. A freshman, yeah. And there are no undergraduate programs, so it was really just about graduating with a bachelor's and then going on for my master's. But that was it. It was just a spark, an idea that a professor gave me, and I never looked back. And so my first exposure to dance therapy was as a student.
Okay.
Yeah.
And so how has your understanding of dance therapy changed since you graduated and gone into practice and set up your own business?
Well, the more I talk about it and the more I practice it as a clinician, I definitely integrate it myself more. I understand it more. I learn something new every time I'm with a new client. I think what I've mostly learned is that when I first went in, I used movement myself as a form of expression. I wasn't quite aware personally of how my own movement dictates or tells you about who I am. And so really having to be in my body more often, because I tend to be in my head a lot, was challenging. And that's something I continue to work on myself, and something that's so rewarding, because the more I can be in my body, the more present I can be with my clients.
And your family. And
Well,
your
yeah,
friends.
yeah, absolutely. And my daughter.
Yeah. So, like many therapists that I've interviewed, they recommend meditation. They're always doing something for their personal growth. Do you actually do movement therapy for yourself and by yourself?
So it's difficult, I would say, to do by yourself. I think a lot of it does require someone to witness and recognize outside of your own body, because
Is
we
that
have
something you were taught, or just something you've just come to understand about the witness?
something I've come to understand. I mean, I definitely, it was taught and modeled in school, but more and more it's something I'm definitely understanding more of as I do the work myself. So I've as a clinician, I get supervised, or I've been supervised in the past by a movement therapist, mostly because it feels comfortable for me. I like having someone who I can say, hey, I did this, in this session, and I can bounce ideas off of them, but that they can also look at me and say, are you recognizing this? Do you notice this about yourself? Because even as a therapist, I have my own body biases, body prejudices that I might not even be aware of. And so it takes another therapist or movement therapist to recognize those and kind of call me out on them from time to time. So.
Good. And do you meditate? Do you recommend your clients meditate? Well, I would assume the senior population, or end-of-life-ish, people with end-of-life would be difficult, but what about the younger ones?
Yeah, so oftentimes in our sessions we will do sometimes what we call guided imageries, which some of our clients talk about or will use the word meditation. Sometimes they'll create their own meditations, and for me meditation is more, I always say, finding the quiet within, right? Because sometimes we think that in order to meditate, it has to be facilitated in the most quiet, pristine space, and maybe light music is playing or the shades are drawn. And, for us, a meditation sometimes is more what we'll call like a body scan. So I tend to tell my clients or teach them a little bit more on just how to resource and how to just go through the body and notice your own feelings, sensations or lack of sensations in the body, versus formal meditation. So, there are so many wonderful meditators and facilitators out there that have fantastic, like, pre-recorded meditations that I feel like I kind of leave that to the experts. But there are ways that we can kind of incorporate or almost do like a body meditation in a lot of our sessions, and then kind of suggest it as homework.
All right. Well, we've got about a minute 15 seconds.
Sure.
Please tell the audience whatever you want them to know about dance or movement therapy.
Sure. I think I just want the public, society, to know that movement therapy isn't about being a good dancer. It's not about having coordination. It's not about even loving or enjoying dance. I think most of my clients would not call themselves dancers. But if you are experiencing kind of a disintegration or feeling like your physical is not really matching your inner, your psyche, your internal.
Or even a social problem.
Yeah, movement therapy is a great way to just create a more holistic approach to wellness. And again, just recognizing how we sit, how we move, and how maybe it's not working for us, and working on adapting it and changing can ultimately change the way we think about things and the way we approach problems.
Well, as somebody who did it as part of a group for 3 years, I could not agree with you more. For more information about Erica, InnerQuest, Infinity Foundation, until next time, wish you good health, good spirits, and good fortune. Thank you so much.
It was nice to meet you.
Same here.
Information about this show, our guest, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828.